Okay, we're up to our last segment this afternoon. At this point, let me just go through the bios of our panelists while we have them mic'd up. Dr. Lisa Indar is an innovative public health scientist specializing in infectious diseases, travelers' health, and food safety. She has 18 years regional and international experience in the managing and executing of regional public health surveillance and response programs with response leadership, multidisciplinary technical expertise, epidemiology, microbiology, food safety, environmental health, health diplomacy, communications, implementations, capacity building, resource mobilization. Dr. Indar is the director of the Surveillance Disease Prevention and Control Division at CARFA, responsible for directing, coordinating, and managing public health surveillance and response activities related to conditions of regional and international importance. She's currently the technical lead for CARFA's comprehensive, multifaceted regional health response to the COVID-19 pandemic, working with CARICOM heads of government agencies, international, regional, and national multi-sectoral stakeholders to keep the Caribbean safe and promote a safe and economic recovery. Let's hear it for Dr. Lisa Indar. A round of applause, please. Our next panelist is Dr. Kirk Douglas. He's the director of the Center for Biosecurity Studies at UWI's Cayfield campus. He's a professional senior scientist recognized both regionally and internationally for impactful scientific research in the fields of virology, zoonosis, biosecurity, climate change, microbiology, and infectious diseases. He earned a Bachelor of Science degree in microbiology in 2001, a Master's of Philosophy degree in microbiology in 2007, and the Doctor of Philosophy degree in medical microbiology in 2020 from the University of the West Indies, Cayfield in Barbados. In addition, he holds a Master's of Business Administration degree with Merit Honours 2019 from Warwick Business Schools and University of Warwick in the UK. That's Dr. Kirk Douglas. We'll also have on this panel Mrs. Carla Marcelle-Boyce. Is a food safety professional with over 15 years experience in the private sector and state organizations in developing risk-based plans, policy and food safety management systems for the food and agriculture industries. She's an experienced food technologist with broad industry and operational experience in food science, technology, food systems, quality management systems, quality assurance, product and policy development. She's a certified HACCP food and safety quality auditor and lead ISO 9001 auditor quality management systems and competencies in quality management systems auditing, leading management systems audit teams, and a preventative controls qualified individual under the U.S. Food and Safety Modernization Act, FSMA. That's Mrs. Carla Marcelle-Boyce. And last but by no means, someone who's been advocating for tourism sustainability in the Tobago sector for many, many years. She's a strong and vociferous advocate of sustainability of economy and diversification of the economy, focusing on tourism and sustainable tourism products. And she's none other than someone you saw earlier on, Miss Diane Hadad. This is our panel for this afternoon. If you can please welcome them to the podium, the stage, sorry, with a round of applause. And I have the pleasure of moderating this panel. So you can give me a round of applause too. Good afternoon, everyone, and thank you for joining us. Our topic this afternoon in this segment is tourism and public health. They are related, and of course, managing the risk to sustain and grow these economies. Let me start by allowing opening comments, starting with Dr. Lisa Indar.
Hi. Good afternoon. Can you see me?
Yes, and hear you loud and clear.
Okay, great, great. I'm really happy to be here. Sorry that I couldn't be in person. I'm actually just opposite you in the Hyatt at another conference. Yes, but yes, tourism and public health. Let's start by saying the Caribbean is the most tourism dependent region in the world. And so the health of the Caribbean people, by extension, is very, intricately linked to our tourism sector. And why is that? Because the first case of many of our illnesses has been imported. First case of COVID-19, the first case of SARS and Zika and chikungunya all came through imported cases through our tourism sector. However, tourism is our bread and butter. We need to have, it is the key and the main economic contributor to economic recovery, to economic growth in our economies. So for us, when we look at tourism, we see that it is important to ensure that the health of our tourism sector is addressed in the same manner as we address the health of our local population, so that any visitor who is coming to the Caribbean will feel safe and secure. And in that regard, we created 4 years ago the Regional Tourism and Health Program. Now, this program, we call it innovative and novel because there's no other program like this in the world. And this program addresses the health, safety, and the environmental challenges that impact on the tourism sector. And in a nutshell, we develop real-time surveillance systems. It captures information from anybody in the tourism sector, whether you're land-based tourism or you're in the cruise ship setting. And it gives you an alert that if something is happening, it alerts you that something is happening. So you reduce spread. And together with that, we have training and guidelines and policy and other sustainable mechanism so that we build the capacity in the tourism sector so that you are equipped with knowledge to prevent illness, and you're equipped with systems that if something happens, you are able to nip it in the bud, because you don't want an outbreak occurring, among your tourist sector and spreading. Take, for instance, when we started this program, it actually started because you had one outbreak of norovirus spreading over 3 days from less than 50 cases to over 800 cases. So it spreads that quickly. The other thing about this program is that we have multi-sectoral partnerships with health and tourism sector so that, we are able to be able to mitigate and implement. And finally, we have something called a Caribbean Travelers Health Stamp. And that stamp tells you, if you have that stamp, you are promoting a healthier, safer product. It's recognized worldwide, and it's recognized by our regional agencies, so that a visitor is coming to the Caribbean, they have a healthier, safer option. They can come to the Caribbean and says, well, okay, let me go onto our Travelers Health app and be able to say, well, which is the preferred destination, the preferred taxi driver, the preferred hotel to stay, and so on. So CAFA is really looking at health and tourism as a part of our economic growth, economic resilience, and even especially after COVID, as part of our economic recovery. We see that if you do not address health and tourism, it is a risk for our economies. Thanks.
Thank you very much, Dr. Indar. Let's go now to Dr. Kirk Douglas. Opening comments, please.
Good afternoon to the panel and also to those at the conference and to CRMA. I would start with also echoing the sentiments that Dr. Indar mentioned in terms of tourism being a critical vulnerability to not only health systems, but the overall biosecurity systems, because there are four main vulnerabilities that you would find in biosecurity systems, one of which is tourism, another is international trade as well. So this is also another pathway for the entry of pests and pathogens, such as COVID-19 and some of the other viruses and bacteria that you see. Also, transport and travel as well. And then you have the other pathway of migratory wildlife. So whilst your border security that you have in place at the port health, whether this be at the airport or the seaport, there is that critical vulnerability to migratory birds that come in, because they do not subscribe to the port health guidelines. They need neither a passport, neither a visa to leave one country and go into another country. And whatever they have, they will be bringing to that particular country. So that's a major vulnerability. And that also affects tourism, because once there's an outbreak of something that is within a country, that impacts in terms of the attractiveness of a particular destination for travelers. But just in general, we would see that with climate change, this is a strong trend that we are observing around the world, where we are having increased sea level rise, we are having increased temperatures. These all impact upon the tourism product that Caribbean offers. And therefore, these are things that we must be mindful of and that we must understand and be adaptable towards. And not only in terms of climate, but what climate means, or the influence it has in terms of disease transmission dynamics. We're going to have perhaps even more vector-borne diseases because of the shift in climate, the increased temperature, the increased intense rainfall patterns that we will start to see, because the climate projections for the Caribbean indicate that what we will see is less total annual rainfall. However, when we do get rain, it will be in short bursts and more intense. So this means that we'll be more prone to flooding, flash flooding, and even landslides as well. But on the flip side, it will be drier overall. And so the increase in temperature can also increase the risk of drought. And this has implications for vector-borne diseases, because it is kind of counterintuitive. You'd think that with rainfall, you will expect to have more spread of, for instance, dengue. But in fact, what happens during drought is that human behavior changes. So people actually store water during droughts, or during periods of time they have inaccess to water. And this also increases the risk, because you're bringing the breeding ground of that mosquito close to your establishment, close to your home, and that increases the risk of you actually making contact with an infected mosquito vector. So these are things that we must be aware of, have in particular risk models that can predict how these changing environment can impact on diseases across the Caribbean, and then how we can put measures in place, systems in place that are really agile, because we will have to act quickly and have to act fast if we want to protect our tourism product. And so I will leave it at that for now and hand back over to the—
Thank you, Dr. Douglas. Let's go to Carla, Marcelle-Boyce. Carla.
Hi, good afternoon, everyone. So I'm a food safety professional, and safety is a cross-cutting issue between tourism, health, public health, trade, and industry. And I don't think persons are aware, especially from the tourism aspect, and from Kirk was saying with the biosecurity aspect. Typical Trinidadians, we like to pack food when we go in our suitcases when we go and when we come back, right? So we have this risk where we can pack a pest, right? And once those pests come into the country, that can be sometimes it's an invasive species, and it can actually kill out what we have here, or we can affect our plants, our animals, etc. I was listening to Dr. Indar just now, and listening to the CARFA Tourism and Health project. And the problem we have in, I can say Trinidad and Tobago, I'm not sure with the region, is that we have a dearth of information with respect to food safety outbreaks in Trinidad and Tobago and foodborne illnesses. Typical Trinis, we go to the restaurant, or we buy food at those malls in the food court after 8 o'clock special, we all know that, and we get sick, and the first thing you say is, oh boy, the pepper ain't agree with me. But we are not mindful that our habits and the culture and the practice that we do has an effect on our body. It has an effect in food safety in general, right? I want to pass it on now to Diane, right? So Diane, you will link.
Took over your role.
That's all right. Let's go to Diane.
What I see is in terms of when we speak of tourism and we speak of public health, as a country, I don't know that we have taken this thing about public health seriously in terms of how we even run our own homes to start with. I want to start there because, you know, we speak of the businesses and so, but I don't know that we have taken the pride in how we speak about cleanliness around our homes, the things that impact the very environment that we live in. And from there is where I want us to start as a nation in terms of us looking at getting any sort of correctional measures, because I really thought COVID was going to bring a massive change to our thinking. And I also thought that, I have to tell you all, I enjoyed COVID for the 2 years. I was just explaining it to persons out there. I had the best team, I had the best morale. It was such a great time for getting things done because everybody else was hiding under a rock. I enjoyed the space. But what I thought was while persons were hiding under the rock, that they would have recognized their role as a human being on this earth, and they would have come to some realization as to how when they come out, or may I say when they are allowed out, that they would have had a new mindset in terms of how we were going to live or elevate in this new space, this new world. Unfortunately, that is not what I have observed or noticed in terms of how persons have, we did not take care of our country. We have chosen not to in terms of cleanliness. How do we maintain our surroundings, our drains? Each one of us as an individual employed in different entities are not doing our part in depth in terms of collecting our salaries. So we all have a role. When we speak of tourism, tourism is really the movement of persons who want to enjoy or have an experience in your space or in another space. And therefore, that entire experience, it's just what you want when you go anywhere, which is friendliness, cleanliness, courteous, service, that whole thing about that experience. It's the same thing that you want. And what we have missed and continue to miss, disappointingly, as I said, is that we didn't go internally and decide how we are now going to, as a country, give more for this world that we share. And Warren this morning said a couple of things which I don't know if many people connected the dots. Every example he gave, it was about the animals and how they adapt. It was about the animals and how they were in preventative mode by their connectivity to the universe. And that had to do with their level of consciousness in terms of how they exist and how they participate on the earth that we live on. And that for me is a big miss because we didn't connect those dots. Humans tend to feel that we are superior, and because we are superior, we have the right to be wrong. So we always have a right to be wrong and do what we want because we are superior. And that's why we keep having to have these conferences and have these discussions, because we are just bouncing our heads all the time and creating accidents rather than going internal, and all of us have a responsibility individually. So I want us to look at and take, if nothing else from today, would be what Warren Black spoke about today in terms of the connectivity with how the animals interface. They adapt and they adjust to everything. And there's no need for us to live in fear, because what we have to do is love and treat this just as if we wanted it for ourselves alone. So just as we want to live in beautiful homes and we want our space clean, what I find interesting, we don't, there are people who don't have their business places externally, looks good, don't go to the back. Don't go to the back. But are the health officers doing their roles deep enough to ensure that that is carried out properly? So I want us, for me, we speak of tourism and we speak of people will come here, people want to move. We have a product, but what are we doing with it? So I would want to share today that all of us, and my message is really a little deeper and a little offbeat to all of this. We are the risk. We are our risk.
That's a good place to put a pin there. Let me bring next to your opening comments on the issue of tourism, public health, and sustainability.
Thanks. The hat I'm wearing in this panel It's strongly related to the company that I manage the risk portfolio for them. That's a company named Sanitech. Most of you may locally here may know Sanitech as that company who's working with the 2 designated hospitals managing COVID-19 for the last 2 years. What is that the principal role they do in that regard is in terms of IPC support to the organizations on a continuous basis, and they've been doing so since the outbreak of COVID-19. What is that is lesser known is that the organization was actually in this specialist role for about 10 years before that, doing hazardous disposals and in a specialized focus area. But I say that to bring to the point that something that, again, Warren Black mentioned this morning, and he said, world was not prepared, or we didn't see this pandemic coming. And respectfully, I disagree with that. We in the West may have, while it is that we may have known it was coming, largely ignored it. If you notice the countries that are more in the Far East, Korea and New Zealand, Japan, while they experienced it heavily as well, they were able to rebound a lot faster and put mechanisms in a responsive manner a lot faster, because they were subject to more localized epidemics in the last 10 to 15 years, H1N1, swine flu, that kind of thing, those kind of outbreaks. We in the West largely avoided that, and there's a tendency to believe that was a problem over there. It doesn't reach us. It was something they are dealing with. But World Health Organization and other health organizations always knew of the increasing risk of this type of event happening in the West, even though those signs were being largely ignored. And that's a very broad general brush, but the facts of the last 2 years have borne it out. And that risk has become even more so tangible and realized because of an increasing push by commercial and business sectors for even increasing profits and efficiency as we move towards economies of scale in terms of logistics transport, in terms of making that extra push towards efficiency and profitability. And nothing is wrong with that. But what it did, it has exposed a serious risk exposure and an underbelly of how vulnerable we were and are to those kinds of shocks to the supply chain. So that when that risk became realized, the world went into shock with respect to its supply chains in a number of different regards. So even in terms of getting critical supplies, even where they were being manufactured at point X, they couldn't get to point Y because of logistics. In addition to that, what it left the more of the Western world seriously exposed to was that lack of preparedness in terms of being able to handle the effects of this virus reaching us so quickly. Closer to home, and I'm speaking from a perspective really at being in the sharp end of the stick. You have some, Dr. Indar's organization, CARFA as well, has done some tremendous work as well at the regional and the policy level. And she gave some excellent examples as well to have putting in that kind of infrastructure and framework. But that's largely, again, at a policy type level. You have Dr. Douglas as well too, has done, and through UAK Hill, have done some tremendous work and making some good strides as well too on the academia front as well too, and programs on biosecurity. That's excellent, which I will be talking to Kirk about a bit later as well. But practitioners at the sharp end of the stick who have to deal with this on the ground, they have been faced with a number of realities that were generally not known, not considered as well. Take, for example, I'll just give you one example at this point. By the time the pandemic hit our local shores, and you were then relying on certain types of response mechanisms, including arms of the military, to give that type of broad underlying support and so on. But when were they trained? How were they supported? And these things were largely absent. We just take it for granted, right? And the truth be known, I'll tell you, my organization did a lot of behind the scenes training and support, which we did pro bono, and which we continue to do. I say that to say that we need to be better prepared. And there were a number of the underlying mechanisms. Ms. Subero, in the last meeting, when she was just wrapping up, she made the point that when you have a lot of risk infrastructure, and that she encountered as well too, and there's an underlying belief that, oh yeah, that's that particular mechanism in place that will handle that risk, and oh, yeah, this mechanism in place. The reality was, when that pandemic hit our local shores, there were a number of controls that were thought to be there. On paper, were there, but in reality, they went poof in an absence, including the very real reaction of a number of people, including in the health sector, of this fear, very real fear of I may get this, and it's a real thing. You're hearing about this very, very deadly virus that's causing mass mayhem, and you're seeing these graphic pictures coming out of hospitals in Italy, and you are experiencing to tell medical professionals, you are there, you know, you're not in an office hour, you are there working hand and
so they are
day and night.
their own personal
They have
exposure.
to, that's very real, and now
put a pin there, because
right, and going back to their families, so it's a very real thing.
Thanks. What I want to do, because this is a Caribbean risk management conference, so while we are saying we are in Trinidad and Tobago, but the region is not as homogeneous as we might think. Different countries have different capacities. Different countries have different levels of infrastructure. Different countries have different response mechanisms. So I'll go start with Dr. Indar, then go to Dr. Douglas, and come down to the panel to think about how do we reconcile the different regions, although CARFA is a regional organization, creating policy and providing support for the region. How do we reconcile as a region in the context of tourism, in the context of public health, the different states' capacities and their ability to respond to public health threats and food security threats in this context, in the context of tourism? We start with Dr. Indar, and how has that experience been from your perspective where you sit? Audio text.
Sorry. Are you hearing me now?
Yes, we're hearing you now. Go ahead, please.
Right. I said the beauty of where we sit, you know, CARFA is the regional public health agency. It starts with to be able to, you know, mitigate any form of policy in government, you have to start at the highest level. And so CARFA has an IGA, or intergovernmental agreement, where we are mandated on behalf of our 26 member states to provide surveillance, to provide response actually, and to lead in emergency and response. So it starts at that level. And so it gives us certain autonomy, where we would then be we have a certain convening power to work with our heads of government, our chief medical officers, our ministers of health, to really come up with guidelines and principles of operation for risk management, for improving public health, improving food security, for improving food safety, for reducing, you know, for improving response to emergencies. So, and a good example is how we did that with the pandemic. When the pandemic came, and the previous speaker spoke about we need to be prepared. CARFA was prepared. One of the good jobs, or one of the things that we do, is that through our systems, we're able to rapidly identify. So even before we found the first case of COVID in the Caribbean, we were already prepared, and we were available, we were ready to test, and we were ready to respond. We had guidelines, you know, our first case was identified in March, but by January 21st, we literally had the convening power with all our chief medical officers. We activated our incident management team, and we came out with guidelines for response. This is a new pathogen, it's new and emergent, this is how it looks like, this is how you should respond, this is what you should do in terms of, you know, testing and so on. And then we created, because of where we sit to, we created this multi-sectoral coordination because we have many agencies that are working together. So at the highest level, our international agencies, the PAHOs and the WHOs, and then the international agencies like CDC and so on. And then we have the regional agencies that are all impacting the tourism and health. And again, a good example of the tourism and health program is that we had, we brought in CHD and CTU, and CAFA as a member of CARICOM is able to do that. So we created many different policies, guidelines of response, guidelines of border security, guidelines for food safety, guidelines for testing and so on. However, I have to say that you can create a lot of guidelines, and if you don't have that willpower and that government and willpower, as well as that buying, it doesn't always happen. So we could create these at the highest level, and we had heads of government signing off, but then it's still up to that individual country and the different sectors in the country to say, we are going to do this. So it takes a commitment. And one of the lessons learned from COVID is individual responsibility. So I think it was the second or third speaker spoke about food safety. Why are people going to buy food at 5 p.m. in the afternoon? Because they know it has been left out for more than 4 hours. And anything left out more than 4 hours, it's really bacterial or any kind of or growth has been so much that that food is unfit. So it has to have that individual responsibility together with the policies, as well as an advocacy and a communication. Do our consumers know? Well, that you shouldn't keep food out for very long, that it shouldn't be more than 2 hours. Do people understand the risk of an epidemic? And even now we are reducing practices for COVID. We have stopped wearing masks, we have stopped testing, but COVID is still here and our numbers are still increasing. But individual responsibility, when you go into a crowd, do you wear your mask? Do you continue? If you're going to a meeting, do you test? So it's a combination, and affecting change, it's one level to be able to advocate and to get the policies, but it then comes down at a country level if they want to do it, because of course you may have tourism saying, well, I want to do something different, and health is saying something different. So you have to have that harmonization where you can say, well, what is best for public health? What can you reduce in terms of mitigating risk as much as possible? I know I said a lot, but from where we sit, it's been challenging to affect that type of change, but we need to work together more and to really walk that talk.
Thank you, Dr. Kirk.
Thank you.
How do we reconcile different capacities, different islands? As Dr. Indar said, the policy is there, the mechanisms are there, the guidelines are there, but different countries, either depending on will and or capacity, had different outcomes. How do you feel about how we fared and what we learned from it?
Sorry, I was muted. I think honestly, from my perspective, the beginning of the COVID pandemic and the response that the Caribbean had, I thought was exemplary. I thought it was quick. I thought it was cohesive, and everyone seemed to be pulling in the same direction because everyone was basically at the same level of awareness, not knowing exactly how it would turn out. And so they felt more secure together. But I found that as the pandemic evolved and everyone started to kind of get their own sense of how the pandemic was evolving, then you saw or witnessed a separation in terms of a customization of guidelines for their own individual countries because they wanted to have a competitive advantage. And I think that that could be problematic, not only for COVID, but I think for the other pandemics that will come, the other outbreaks that will come. I mean, COVID is not yet finished, and out of the clear blue sky comes monkeypox. And so we will continue to observe an onslaught of these zoonotic infections. And I think that we have to not rest on our laurels. I think that is very critical. Because we did the first initial response for COVID, it does not mean that we're prepared or adequately prepared for what is to come. We have to take, as the old adage in cricket, take every ball on its merit. Every single risk has to be analyzed on its own. It has to be given the requisite respect, because just one previous success does not guarantee future successes. And I think what would benefit the Caribbean, there's some lessons that we can learn from COVID. One was the rapid testing. Rapid testing allowed persons to not only understand whether they were infected, but primarily if they were infectious. That is very critical as it relates to tourism, because ideally Port Health doesn't only want to know if the person is infected, because they could be infected, have a positive PCR test, but be of no real threat to public health, because they may be in the back end of the infection, and what you're just detecting is the nucleic acid of the pathogen. I think that is a very critical lesson that we have to learn as it goes forward in terms of public health and surveillance. What are the key testing strategies that we can employ that may be low cost but yet effective? Do we have a risk matrix for countries analyzing the incidence of certain diseases and then applying that on the ground in each individual Caribbean country to say, well, look, we recognize that this is a real risk problem. For instance, with monkeypox coming from Nigeria, or persons that are coming from hubs that have high volumes of traffic from Africa, such as London, Heathrow, and Gatwick. These, and I know personally because I have a colleague who works in NHS in the UK, and he actually indicated to me that they were having these challenges, and that monkeypox was something that they had sporadic cases coming from Nigeria. And this is important because these quote unquote infrastructure, the travel infrastructure, is what accelerates the spread of pathogens that was absent, let's say, in the 1950s and 60s. We're living in a totally different age at present, and everything is moving quicker and faster, and therefore our speed of adaptability has to be at the same requisite speed. We are even faster because we have to get ahead of the curve. And I think these are important things that we need to understand, even in trade as well. So not only tourism, but the movement of goods and foodborne illnesses from time to time, whether it be a processed, we see peanut butter recently, Jiffy peanut butter with salmonella contamination. How do we have effective controls within our system to recall items that may be a problem in another country, but they're being sold widely throughout the community? How do you rapidly identify it? Do we have systems in place to do that? These are the questions that we have to really, and they're hard questions, but I believe that they are very critical and important questions that we need to answer. So in summary, I think the Caribbean is not prepared, to be quite honest. We are nowhere near where we ought to be. We have to be honest with our level of preparation. We desire to be prepared, but I think we were a bit fortunate with COVID-19, but there's a long road ahead of us, and we need, as Dr. Indar mentioned, the political will, the buy-in from the community, to us to work together, not only individually as a country, but together as a region. We are too small individually to impact the world in any effective measure and sustainably. But together as a region, I believe we stand a much stronger chance to being successful.
There's that regional context coming in again. Next question is for Carla, Marcelle-Boyce, and Diane Hadad in terms of the hats they're wearing today, food safety and public health. Earlier on this morning, Warren Black spoke about agility or awareness, preparedness, responsiveness, and agility. Given what we've gone through with the pandemic and public health in the context of tourism, do you think we've gotten the lesson and we are more aware, or we're aware of what are we looking and we're surveilling effectively, like the meerkats this morning, the example? Are we more prepared because of the learnings that we may have gotten? Are we more responsive? Do we have more responsive mechanisms in place? And are we more agile? Can we actually pivot? Starting with Carla.
Paul, What I've realized is that you can have the best policies in the world, but if you don't have the people to put them into action, then they are completely useless. From my work over the years, I've seen a lot of egos writing checks that bodies just can't cash, right? We have all these high-level policies. There's no one to implement, right? There's not a culture. For example, the field I'm in, organizations, they don't have a food safety culture. They don't understand that food safety is everyone's business. They would say, okay, it's the government's business to have that legislation in place and the policy in place to have proper laws. They would say, okay, it's the manufacturer's responsibility to ensure whatever is leaving his or her place, it's safe for me to consume. But they're not looking at the consumer. For example, we are the ones, it's everyone's business. Everyone has a part to play along the value chain. So with respect to our preparedness and response like Diane, I was happy for COVID, because if you realize most foodborne illnesses are caused by persons not washing their hands and not practicing proper hygiene. So we found that with the advent of COVID, we had a reduction in foodborne illnesses because people were practicing proper hygiene. Everybody was washing their hands with soap, singing the ABCs or the alphabet.
Past tense.
Oh, yes, and we're still supposed to be. I mean, according to Ken, we're intra-COVID, we're not post-COVID, right? We are supposed to be continuing doing these things, but we have lapsed, we have relaxed a lot. But we have seen in this field that I'm in that we had a reduction in foodborne illnesses, but you're seeing it starting to pop back up again. There are a lot of food recalls because I said we are getting relaxed and persons are not doing or practicing what they're supposed to be doing. Right? So with respect to preparedness, I could say from a Trinidadian point of view, in the field that I'm in, food safety, we are not there as yet. We have a lot of policies. We don't have the people to put them in place. When last have you seen a public health inspector in your food strip in the savannah or on the cross? Who is doing the surveillance? Who is doing the monitoring, ensuring that the food that is being sold is safe for us? When last did you see a food and drugs inspector in the supermarket? You go into some supermarkets and you see products on the shelf that is not even in our native language. It's not even in English. And our laws state that the products must be labeled in the country's native language. I can go to a supermarket in San Fernando, right, and see only products with different languages on it, nothing in English. So with respect to, I'm bringing it back, with respect to are we prepared? No, we're not. And I was telling Ken and my other colleagues earlier on, it's very easy to have a wipeout in Trinidad and Tobago. We're greedy, Paul, we're greedy, we all are greedy. You go to the stadium and somebody is selling something in front. Nobody checks to see if that person has a food badge. Nobody checks to see if that person is a qualified food handler. We are not ready, we are not ready. It's very easy to wipe us out. And with respect to COVID, as I said, as COVID came, in our field, we were happy because COVID came and the foodborne illnesses went down.
So we didn't get the lesson.
We did not learn the lesson.
Diane, from a tourism perspective, I mean, you were based in Tobago and Trinidad and Tobago. Yes, we tout tourism. I know we've had several conversations about this, but Pan-Caribbean, the islands who depend on tourism for their livelihood, for their life, Jamaica, Barbados, Grenada, as a region, and then more granularly as a country, Trinidad and Tobago. Did we get the message? Are we more prepared? Are we agile?
No, and that's what I said earlier, Paul, we have lost the whole thing mashed up. That's the truth. Our structures, we have policies, we have them. Have technocrats that write lovely documents. We have all of that. We don't lack for any of that. I mean, I have been on the committee, Food and Drugs Committee. I have been on several committees representing the community. And it's not that we don't have all the documents well laid out. What we do not have is the people who carry out their roles and functions. And that is where the issue really lies. If I have to go through the tongue and country process to get my operation processed in terms of getting approved for food or whatever, the building, the use, if I have to go through health to get, the whole process is so rigorous and not easy. The ease of doing business that we all make it a nice language, ease of doing business. The truth is it's frustrating to get anything done because nobody's working. And that culture has been set in so poorly, and it's not just in the public service, it's now in the private sector as well, in terms of how you motivate people to get them to actually produce for their income. That is the biggest fallout that we have. Not just the other islands, Barbados, they have leaders that speak to them from a perspective, St. Vincent, so that they understand what tourism means to them. We have always had the competition of oil and gas, which is, you know, our entitlement of royalty, so we don't have to do anything. And that has been inculcated and it's multiplied over the years. So it's very hard to flip. So as I said, as Carla was saying, I really thought COVID was going. When did we lose that you had to wash your hands every day in school from elbow down to get?
So it's 6 million dead around the world. I think Trinidad and Tobago's count is around 3,000. Am I exaggerating?
No.
Dexter, we missed that opportunity. And if a pandemic doesn't open our eyes to the inherent risks that were present before and instruct us to put systems in place and monitor and apply the systems, what will?
Before I come to that point, Paul, I just want to stick for 1 minute on the point about public health and food, as well as you mentioned before. I think right now, the Caribbean has been pushing very hard. I think the initiative of a growth in agriculture being led by Guyana, Barbados, and a number of islands now signing on and accepting that in CARICOM in terms of making a significant push for improved food security. There's a task force as well to be chaired by Guyana as well too in that front. I think we need to continue as professionals and other directly affected stakeholders to keep pressing on that because one of the things that was long been recognized is a disconnect in terms of the types of policies and regulations that exist within the Caribbean region. Has always been talked about in terms of the very much difficulty, despite as well the tremendous growth, agricultural potential in Guyana, to be able to have those foods come into other areas of the Caribbean, and for various reasons. But the point is, if we cannot be making a one-sided push. I think the task force has recognized that, but we cannot afford to miss the boat. We can't afford to be planting huge crops as well to in one region and then have regulations debar it from going into areas where they be most needed. So I just wanted to make that point, even from a policy and regulatory standpoint, there is still that gap to be addressed significantly. To come back to your point, the question you asked as well to in terms of how of probably missing the boat or otherwise being prepared. I made a point that Dr. Indar and through CARFA and so on has done a tremendous amount of work. It's a huge milestone just to be even to get to that point where as a regional body to have accepted policies and procedures among that level. But there is still a disconnect between a policy level and regulatory to where these people are on the ground. There is that still of a disconnect. So while there's been tremendous strides and maybe precipitated by COVID as well too, towards that sphere in terms of public health, there is still a very real gap between that and those who actually work on the ground in terms of getting things done. I also want to just close as well to come back to that point. I know it's very dear to Kirk as well too, in terms of his work that he mentioned as well too about biosecurity in terms of the zoonotic threats. We have a threat that exists right here from the illegal importation of animals that come through the South American close border that we have with Venezuela. And that's a very real threat. You speak to farmers on the ground and you say, look, how you could be selling goat, fresh goat. We are in the Caribbean, you eat a lot of fresh goat and duck and so on. How could you be selling goat for $15 a pound and there's 2 blocks down as well to $35 a pound? What's going on now? I said, well, and it's simply this. If you have to grow an indigenous ruminant here in Trinidad, I'll give Trinidad as the example, it may cost as much as $1,500 per head of animal. However, they can buy it illegally for half the price, even though that animal may have been diseased. And very often we see that, including the company I'm working with has to go and do disposals as well to a lot of those things. So it's a very real threat when you talk about food security with these kind of illegal activity that feeds in. And it's not only affecting Trinidad, that's not a Trinidad thing. I'm just giving an example. It affects other areas in the Caribbean as well, the illegal wild meat industry.
We are going to open the floor now to questions from the floor, if you will. In terms of moving forward, how do we, and this part of this segment is on tourism and public health, how has the pandemic impacted the region in terms of tourism, in terms of the global competitiveness of the tourism product or products in the Caribbean? And what is the impact of public health mechanisms on that? Those are obviously more stringent public health methods and responses make us more resilient, make us more attractive as a tourist destination regionally and individually. Let's start with Dr. Indar on that, and then go to Dr. Douglas and come down the panel. And of course, once again, the floor is open for responses and comments.
Would you mind repeating your question, please?
The question is, because
Sorry.
of the impact of the pandemic, the Caribbean region's competitiveness as a tourist destination compared to Europe or Australia or the South Pacific, etc., or the US, and how our public health policies and implementation of those makes us more or less competitive.
Yes, I love that question. I really love that question. And I want to say that we are more competitive, and for many reasons. And it goes back to having regional solidarity in certain things. So when COVID came, the Caribbean literally around, if you remember, around March to April, there was an immediate lockdown. Even before COVID cases were identified in some countries, but there was solidarity in that, and that prevented this huge spike. So while we see spikes and we see increase in numbers, we didn't have those spikes where you had in the UK and US going up to millions of cases. And even now, our numbers, we have just crossed over 3 million cases, but that's among our 26 countries. And while we have been doing that, we have done some things well and some things not so well. But when it comes to the tourism sector, we have managed to do a lot of things well. One, we have come up with the tourism policy, created the policy for recovery. It was created by CARICOM, CTO-CHT, and CARFA, where for the first time, we were infusing health into our policy, stating, you know, while we are doing economic recovery, while we are mitigating COVID, it's important to do testing and to do masking and so on. And you probably would see that the Caribbean is one of the few regions that still require testing and, you know, vaccination status. Not all countries, but we're still doing that. So where we start in terms of competitive, there's something called the World Travel Tourism Index. And if you look at it, you would see that our numbers are up there with the others in that first 100 and the first 90 and the first 50, depending on the different countries. And that's because whilst we have had cases, we have managed to recover and bounce back very quickly. So Jamaica and Bahamas and Barbados, they have bounced back, and their numbers in terms of the tourism sector has increased. So I just came in last night from St. Lucia, and the airplane for that came in through the UK, it was filled. And it's because people see the Caribbean as a safe and a healthier destination. Having the tourism and health stamp together with the world travel stamp and advocating for that is important. So during COVID, we trained over almost 10,000 persons from the tourism sector, you know, how to do things better, how to make sure from the time a person comes into the country till they leave, what do you do, how COVID stays on surfaces and so on. And we believe that has been important because we are not seeing what we are seeing in other places. We are not seeing this large amount of deaths. We are not seeing tourists getting, you know, a group of tourists getting sick due to COVID. And if they do get sick, we have the tourism and health information system. And this is something you don't see it is reported, and we have epidemiologists at CAFA that picks it up. Even if it's 10 o'clock in the night, they pick it up and they work with the country. And, they mitigate spread. They mean, they isolate, they encourage the hotel to, to isolate the persons or to get them tested for prevention measures. So I think we're in a good place. I think the Caribbean, because of its solidarity, and I think that we can, and because of the different measures, we are bouncing back, and we're in a good place in terms of tourism resilience. But I say it with caution for all the other speakers, what they have said. It still comes back to personal responsibilities. We can be the people to cause this to go well or not to. Hand washing, that's the most old adage, if you have clean hands, you're going to reduce illness. And people seem to have stopped that. And so we have to keep advocating for some of the, the public health measures while we mitigate COVID. But I believe that having the systems in place, the structure, and having the solidarity will go a long way for us.
So we head to a close. Dr. Douglas, your response to our competitiveness based on what we've learned. And of course, you can include your closing comments also. Dr. Douglas.
Sorry, I forgot to unmute. I think once we remain as a region, collectively, that we will be competitive. But I think what we have to reimagine the tourism product. I think that's what we have to do. I think Barbados illustrated some innovation during the pandemic. I think it was, I'm trying to remember the term that was used, but a nomad, digital nomad, having persons come in to work remotely during the pandemic really redounded to the benefit of Barbados. I think that was innovation on the fly. So with these pandemics and these risks, you will always find opportunity. And I think this is what Warren Black had mentioned in terms of, when you see these things occur, it depends on how you handle the risk. If you handle it effectively, you can actually turn it into an opportunity. However, if you handle the opportunity incorrectly, you can actually turn it into a risk. So I think how we go forward as a region will play a very pivotal role. We have the agencies, CARFA, we have CARICOM Impacts, we have all of these regional bodies that answer to CARICOM and to the rest of the member states. The challenge we will find is that when it is no longer competitive to remain as a region, and there is a competitive advantage to begin by being nationalistic, what will be the decision? And in doing that, will that then expand or increase the risk to us as a region? I think that is where the rubber meets the road, because it's all well and good when it benefits everyone. However, when as a collective, as an individual, it is no longer beneficiary, is there going to be that same solidarity in terms of working cohesively? I think that is what we have to look. And I believe that now is the time to not only look at tourism, but how we can broaden our competitiveness as a region. Because within the Caribbean, we can develop a regional biotech hub. We have the raw materials. I can even speak to Barbados alone, where we can actually develop a foster an environment where some of these companies will want to invest in the Caribbean to build or to design and develop biologics. And this is nothing beyond our reach, but we have to expand our minds. We have to shift our thinking because we can't go cap in hand. I was in a webinar this morning in Nigeria, and they were speaking about monkeypox. And the professor was advocating very passionately about how African countries are set in the mindset of going cap in hand to agencies, to these Gavi, the global the vaccine consortium, and asking them for vaccines when they have the capacity within their reach to design their own vaccines. And as Caribbean people, I think it is very important that we shift our thinking away from being dependent on the G8, being dependent on other people, because they will always choose their own concerns first. Home drums will always beat first. And we have to take the initiative, leverage the expertise that we have within the Caribbean, and systematically and collectively build our region's resilience. Because Mr. Black mentioned it, resilience is not only being able to survive, but being able to thrive as well. And so that is where I think we need to shift gears, not just survive the Holocaust or the impact, but how do after the impact is there to actually be in a better place going forward. And I think diversification of economies in the Caribbean is very important. Yes, tourism is vital, but we need more. We need a broader economic base, because if global travel shuts down again, then we will be stuck in the same place, asking the same questions, doing the same thing. That is not progress. I'm very sorry, but it just isn't.
Well, the 62-year-old conversation on federation and Caribbean integration. Thank you very much, Dr. Douglas. Let's go to Carla Marcelle-Boyce, the issue of food and food security and safety and its impact and competitiveness, and your closing comments, please.
I want to echo the sentiments of Dr. Douglas. Then there are strengthening numbers, right? And in every crisis, we need to find the opportunity. With respect to the Caribbean, we have this one Caribbean approach, right? But we fail to realize that each island has its own strengths and weaknesses, and we do not play on that. Jamaica's strengths could be Trinidad's weakness, and we can share information. That would make each island attractive in its own right, and then collectively attractive. With respect to food, I have noticed regional colleagues, counterparts, for example, Bahamas. For example, I will stick with Bahamas. Bahamas has BAFSA, right? With respect to the Bahamian Food Safety Agency. Other Caribbean islands, we do not have that level of I could say, commitment with respect to that area, right, that sector. And we can learn from each other. We need to have that one Caribbean approach once more in order to have that competitive advantage when we're dealing with other countries in the world. So with respect to food security, we all know the 4 pillars are the availability, utilization, access, and stability. That is a whole other conversation that I would really like to have that we don't have time for here. But we need, as a Caribbean, need to look at our domestic production versus our imports, what we're bringing into the country and what we're producing for our people to eat. Because I have seen here that some products produced here, the quality for domestic consumption is different to the quality for imports. But that's a conversation for another day. Are we competitive now in light of everything that's going on in the pandemic? As one Caribbean, yes, we are. Are we more attractive? Yes, we are, but there's still a lot of work to be done.
Thank you, Diane Hadad. Integration versus insularity, competitiveness.
The integration is a good conversation, but to be frank, I don't know that we have I don't know if the human behavior is allowing it. You know, that ego part is probably going to flourish, as Doc just spoke about earlier on Barbados and the Prime Minister there and the decisions that were taken. And she became flavor of the moment because she was outspoken and she was creative, innovative, direction. And other persons would have felt, you know, shunned because Mia was taking the front road. And we need to get past that if we need to fix where we are and move forward. If Mia has the talent, and I'm only using her as an example, I don't know that she alone has the talent. But if Mia has the talent, then we have to acknowledge that and let's choose where we are going in terms of the leader moving forward. Jamaica did very well during COVID in terms of how it was handled. And so, you know, so I'm saying that if we need to come together, we need to throw egos out the door in order for us to really make it. We could talk all day. We've spoken about diversification for years. We've spoken about we need food security, we need agriculture, we need to get back to those days where we could feed ourselves. All of that was talk. It continues to be talk. The financial sector needs to step in. They need to have a meaningful part in terms of whether they are going to fund that type of project. It's still a story to be told. That is not happening, particularly for us. The other islands, I don't know if they have similar problems, but we have to understand that for us to grow things, we need funding, we need to develop the manufacturing and the agro-processing. We need to do all of that. Where does it come from? There are people who have the know-how, there are people who have the management skill and the money. So we need to match a lot of things in partnering to get that going. The part of where do we need to, Paul, we need to really sit and decide whether we are going to make change. That for me is the bigger thing. And then we need the right people. That's our cue and clue and healing for everything. The right people that are willing to do the work to take us to where we are going. Too many of it, too many times we have a facade, just as we were speaking in the other panel before, in terms of ticking boxes, corporate social responsibility. Yes, we gave them a bench in the park out there and it's painted. So we did our CSR. We need to get past that. And the person sitting in those chairs have a serious role in the Caribbean in terms of ensuring that they take the people with them where they are, and they are not the only beneficiaries. That is our cue and clue and healing process that needs to take place now with action. Thank you.
Thank you. And last but by no means least, Dexter, is, because a lot has been discussed about integration in the other panels and insularity in the Caribbean, is the tendency to insularity part of our risk profile that we have to acknowledge?
I think it's too much of a broad question as well to paint with one general broad brush. And as one of my the earlier panelists had pointed out, each country is challenged as well too with its own particular gaps in terms of its economies and so on. So while there is a move ahead on certain fronts for a greater level of integration, bodies like CAFA and so on as well too are evident of that, but also examples of the current agro thrust. So while there are sectors that are moving closer towards integration, we cannot necessarily then point a brush and say it will apply in every sector. And there's a pragmatic reason for it as well too. I mean, speak to your friends and colleagues, and family as well too, like in North America. And Diane is much more tuned to the specifics of the tourism industry than I am. I'm sure she'll agree. When it is that we're talking about trying to attract a tourist dollar, and that market is another North American market. When you, again, an average traveler has, let's say, $1,000 spent, where are they going to spend that $1,000 if it's costing them a significant, much more of that $1,000 budget to fly to Trinidad, as opposed to go right to the Bahamas for a weekend? See, it's just a tourism product. So there's nothing to say that was bad against Bahamas, but there's a certain pragmatism about your clientele. I wanted just to make the point as well to the evidence, we live the evidence. The research I was doing last 18 months or so with my colleagues out of Europe had pointed out, and we live it, that probably the very worst area affected by this COVID, the worst hit sector was the tourism sector, and more so in the Caribbean, where significant populations, countries, economies rely on tourism. And pillars of that being hotel industry, the airline industry, and the cruise industry. And those three areas that were widely, globally recognized as most decimated are the three kind of main areas for tourism industry in the Caribbean, more so in the small island states. So we were definitely affected significantly. We are seeing a comeback from it. Has it even come back to pre-pandemic levels where it was already a competitive market? I don't know. I don't think it has. But certainly we're trying to learn from what has happened in the last years. And that last point, have we really started to address the mechanisms from a policy standpoint as well? To Dr. Indar spoke widely about that, and there's a lot of strides made in that area. But let's say, for example, right now, a cruise ship pulls up, and I'm not talking about the ones that people was jockeying for jobs recently. Let's say a cruise ship pulls up right now, and there's announced that there's an outbreak on the ship that needs to be managed. That cruise ship is not going to go back. I don't believe it's going to go back to North America, the point of origin, to address that situation for the next 7 days. It's right here. It pulls up here. Are we ready for that? Are we ready with an infrastructure and a response mechanism that address that situation? I'll just leave that point.
Good question in which to end. Let's thank our panel, Dr. Lisa Indar, Dr. Kirk Douglas, Carla Marcelle-Boyce, Diane Hadad, and of course, Mr. Dexter Daniel. Let's thank them with a round of applause, please. Thank you so much. At this point, it's not on the program, but because we've come to the end of the Q&As and panels for today, we have to the point of closing remarks, and I'm actually going to put him on the spot and invite Mr. Founder himself, Ken Hatcher, to come and give us some closing comments at this time. Let's welcome him with a round of applause for a wonderful day of intellectual stimulation. That's why you get paid more than me.
Thanks, Paul. So for those of you who are still here with us, I want to thank you for sticking around. I know the weather wasn't too conducive to staying in Port of Spain late. I think we still have some folks online, Anisha, yeah? So again, this was a journey. The journey continues. Having this conference is a step or a path. How should I put this? So we are on the runway. CRMA is with respect to the delivering of a finished product to the Caribbean by way of effective risk management. We haven't had liftoff yet. I mean, we are in the driver's seat. We are willing and ready and capable to do that which we intended from the beginning to do, but we need more active participation and from the institutions, both public and private. Some in the private sector is much more advanced than others. I think that was demonstrated by the award that we gave to Ans McCall, and there's no reason why other entities much smaller than they could be eligible to receive an award of excellence in the ERM space. But it's all about the people, notwithstanding everything that was spoken to on the panels today. At the end of it, good processes, good technology, good infrastructure matters not if you don't have the right people in the right position. Good leadership, governance, and that's all about people. So again, I hope you walk away here much more risk educated than when you came in, a bit much more risk intelligent. Some of us probably a little bit uneasy and you want to get up. So for those of us who are still here, and if you are so inclined, non-drinkers need apply. We're having a little soiree poolside. Please feel free to join us. So on behalf of the team, and I must thank my team publicly, maybe I shouldn't call names, but I will. Anisha Beach, take a stand, please. Take a stand, take a bow, bow. Yes, yes, yes. Who is in the back there? Where is Natasha Sibero? Stand, we don't do hands. Thank you very much, Natasha. Where's Charlene? Charlene, where are you? She's probably hiding as usual. Yes? Stand up, Charlene Lewis. She left. No, she can't leave. Okay. Where's my good able-bodied assistant, Santiago? Where are you? He's outside. Hopefully not. I was going to say no. Okay, let me be nice here. And for those of the presenters who are still here, Ambassador, thank you very much. My good friend, colleague, partner in legal criminal activity, Mr. Anthony Sibero, I thank you much. Navin, thank you so much for the support and for coming out, and for your team. Thank you for being here. I hope you guys go back and disrupt constructively more Navin's world. So the rest of the folks that I can't remember, and some of whom I will not forget. Terry Lyons, stand and take a bow there, my good friend. Yes, 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 yes. Yeah. I think because of you, more folks are still here than probably would have been before. So I thank you. Obviously, I can't call everybody who is here. My NGC folks, Ricardo, thank you much for all that you do. And Dexter is around. And last but not least, and he was a little bit quiet this go around. This is the second conference this goodly gentleman has hosted for us. I would like you to give Senator Paul Richards. Fantastic job, sir. And all of a sudden he's being shy. Okay. So I'll leave it to Paul to put the final point on this. I thank you much for coming. There's more to come from CRMA, and I look forward to engaging all of you guys as we go along this path of risk intelligence development. Thank you much.
And let's thank Ken for putting this together and keeping it going. We'd like to remind you to fill out the survey to access the conference material at the end, which is now. So a lot of the conference material and the presentations will be on the Academy's website, but you have to fill out this survey to access. And thank you once again for having me. I had a good time. I was behaving today, tried to save my aggression for across the road with those people. So I was trying to behave today because these people are, well, let me not say that, more amiable. All right, thank you for being with us. Be safe. And once again, don't forget, you can join us for cocktails. Is it poolside, Ken? Poolside, all right? Be safe out there. Thank you so much.